Hello and welcome to episode 129 of Tom's Hirschsprung's podcast. I am delighted this morning to be joined by Jodie. Jodie, welcome to the podcast.
Thanks for having me. Thank you.
Oh, thank you so much for coming on. Now we're here to chat about your son who
Yep.
has Hirschsprung's.
Yep.
I guess, would you like to take us, well, start from wherever you like?
Yeah, I can start from the beginning. When Ollie was born, he was 9 days late, but that wasn't anything like wasn't causing any of the problems. When he got let out of hospital that night, but he hadn't pooed, hadn't passed the mucus plug, or wasn't really drinking any of his milk. But the nurses and midwives didn't think there was any problem with that, so he got home that day and the midwives came out on the second day at home and did a visit, and I explained to her that he wasn't drinking his milk. He still hadn't pooed on day two. We thought maybe it was the milk in the bottles that might have been the problem. So we changed milk several times, changed bottles maybe three or four different times, thinking that that would help, and it never. So then she left and says we'd keep an eye on it again. And instead of leaving it until the week to come back to visit, she came out on day five. By day five, he was sleeping literally like 12 hours. You had to wake him and try and get him to feed. Still wouldn't feed. He was being sick, but it was like electric green. And it was everywhere. But I was like, I don't understand how he can be being sick when there's nothing going in. So once we'd spoke to the midwife, she said you need to go back to the hospital just to get him checked. It might not be anything serious, which obviously escalated. So we went to the Glasgow Royal Infirmary to the maternity ward where they took him into a room, did all sorts of blood tests. I know when babies are born, they can lose maybe 5 or 10% of their average birth weight when they're born, give or take, that they're allowed to do that. Ollie had lost maybe about 30% of that. So he had gone down, his face had all drawn in. Um, but obviously he wasn't drinking any milk, he wasn't getting anything in his system, and everything was coming out through sick. So we then got transferred to, it would have been the Glasgow York Hill, that's not there now. And he got put right in to NICU and blood tests, contrast tests, everything, all the symptoms and some of the tests that were coming back. Hirschsprung disease and cystic fibrosis are kind of a quite close together. So it was either going to be one or the other. So they then did the contrast test that came back as negative for cystic fibrosis. And on day 8 of Ollie's life, he was diagnosed with Hirschsprung disease on day 8.
Wow. I mean, that's quite a late diagnosis, really. I mean,
It was
in
really, really, really intense.
yeah, I imagine so. I mean, that's because usually it's. I mean, mind you, I say late diagnosis. I was about 3 weeks, but
Mhm.
the usual sort of around maybe 48 hours, roughly.
Yeah. And I
I
think
think.
I think he maybe would have got it sooner if maybe the midwives had took me more serious when he was in the hospital when he'd been born. That he hadn't took any milk. He'd maybe took, I don't know, 2 mils of milk or something in the whole time. He was born at 7 o'clock in the morning, and we got let out about 10:30 that night, and he'd maybe only taken about 2 mils of milk. And to them, they said that that was fine. Obviously, it's not. And he hadn't passed the meconium plug or anything either, and they were quite happy to send him home. So I think if they'd maybe took that a little bit more serious, then he maybe would have got diagnosed within that 48-hour time frame.
Yeah, definitely. I mean, it's one of the classic signs, isn't it, of Hirschsprung's, the bile,
Yeah.
the lack of passing of meconium. But again,
His
it's
abdomen was so swollen. Like he looked like he had like a pregnancy bump,
yeah,
so to speak, the way his abdomen, and because he'd lost so much weight, you could see his ribs round where his abdomen was obviously distended.
So all the classic signs, really.
Has literally every symptom probably in the book.
Yeah, yeah. Well, it
Had it
definitely
all.
sounds like it. I mean, it sounds like all of the classic symptoms, but it's one of those things again, isn't it? The awareness, and
Yeah,
sometimes, and it shouldn't be this way, but sometimes it depends on what hospital you're at. There will be
yeah,
some hospitals that will spot Hirschsprung's disease straight away and say,
yeah,
"Well, I know exactly what that is," and then they'll
yeah,
test for it and all of that stuff. And there will be some that will sort of maybe in this case sort of go, well, we'll see how it goes. But Hirschsprung's
yeah.
doesn't really, it doesn't get better on its own. You
No, I
kind of need
think
to
it
do
gets
something with it.
progressively worse. And I think as well, I know as his parents had never ever heard of Hirschsprung's disease. We'd never heard of it. We had heard of cystic fibrosis, so we were kind of like, right, okay, if it's that, we kind of know what to do and what can happen and stuff. But with Hirschsprung's, as soon as they said that, we were like, not got a clue what that entails, what's going to happen, what the journey is going to be like, and what a journey it's turned out to be. That's for
Yeah,
sure.
no, we
What
will
a journey.
definitely get into that.
Yeah,
But it's interesting you mentioned was two things. One, the cystic fibrosis. I've heard that one before, where people have said, well, it's either one or the other.
yeah,
Or well, sometimes it can be neither, but usually you're not going to get both together. So I have heard that quite a few times from people who've been diagnosed with Hirschsprung's, that they've said, well, it could be cystic fibrosis,
yeah,
uh, also, or as well as.
yeah,
Um, but also another interesting point that you made, which I haven't heard before, but is the constant changing of milk.
yeah,
And thinking, right, well, it could be because most times people have just kind of go, right, well, they're not taking milk. Oh, maybe
yeah,
we'll try again later, or whatever it might be. But
yeah.
actually changing milk what was the kind of what was the thought behind all of that?
I think Ollie was my second, and I just think obviously I know there's different milks, there's different formulas and stuff, and I was thinking maybe the one that he's drinking just isn't agreeing with him or he doesn't like the taste. So I was like, we'll change it up a bit. So then we bought another formula and it still was the exact same. He wasn't taking it. And I was like, right, there's only so much milk that you can buy in trial and error. And if he doesn't take it, I'm like, I don't know what else this child is supposed to have. So then we changed bottles so that the teats were different, the flow was different, thinking maybe that's something. So everything I was trying at home, I was thinking that that was genuinely just it, and there wasn't anything significantly wrong with them
Yeah. I mean,
up
obviously,
until that
we
point.
now know what the issue was, but at the time,
Yeah,
that sounds perfectly logical. And I just haven't heard that before. But actually, it
yeah,
sounds, maybe the taste is different. Maybe the way it gets into the body is slightly different.
yeah.
Sounds
It was the
perfectly logical to me.
first thing that I thought of. I wasn't thinking, oh my goodness, he's got something wrong with him, like, or there's something happening on the inside. I was just like, maybe it is the milk. So let's try it. Turned
Yeah.
out it wasn't. It was nothing to do with the milk.
But
The
then,
milk was fine.
yeah. But then, if you'd guessed Hirschsprung's disease at that stage, then yeah, I don't think that was the first
No,
thing that was running through your head at that
no,
point.
definitely not. Absolutely
Um,
not.
but yeah, so it sounds perfectly a logical step to me.
Yeah,
But then, so you said Ollie's diagnosed with Hirschsprung's day 8.
eight. Yeah.
From that point on, because sometimes, again, depending on where you are, sometimes nurses and doctors will say, well, this is the diagnosis, but don't Google it or don't whatever. Were you discouraged from Googling, or was it just find out as much as you can?
So I kind of admitted that I am a serial Googler when he got the diagnosis, and I was told try and stay away from it because sometimes Google gives you obviously all the horror stories and everything, and try and stay away from it. So I got given this booklet. I've actually still kept it. That's what I was given, and it just basically told you what Hirschsprung's was, told you the symptoms, what can happen, how it's diagnosed, and like all the surgeries and everything else that comes along with it. And they gave me that with so much detail for the purpose so that I don't Google it.
Wow. That, I mean,
Their thinking
that's so
was
helpful.
everything that's in this booklet would take me away from Google.
Yeah, that's so helpful. Again, something I haven't seen or very rarely see is
Yeah,
hospitals kind of having some sort of resource leaflet,
yeah,
you know, paper or whatever. That's
yeah.
excellent.
There's quite a few pages in it, and it's basically, it tells you obviously what Hirschsprung's is, all the surgeries that you can have, the treatments, if there's how long term it'll be, the initial treatments and things, which did help because Hirschsprung's disease obviously is ridiculously rare, so not everybody's heard of it or even knows what it is. So we were completely in the dark with the whole diagnosis. Had never heard of it before, didn't know anybody else that had it. That it definitely did help. It was an eye opener and scary at the same time, but it definitely was an eye opener.
Yeah, definitely. I mean, so good that they gave you some more info, but you're absolutely right that it is incredibly rare.
Yeah.
But obviously, there's always well, there's several different types as well. There's at least
Yeah.
six, and then there's sort of total colonic plus, which could be a manner of different things.
Yeah.
But yeah, so it is incredibly rare, and there's no reason why you would have heard of it. I mean,
No.
there's so many people, myself included, who have no history of Hirschsprung's at all, even
Yeah.
though we're told obviously it comes through genes and
Yeah.
all of that stuff. But that's also not to say that it will be passed through the family, because I've known plenty of people, have interviewed plenty of people who have Hirschsprung's, go on to have children who don't have Hirschsprung's. So it
Yeah.
can just be, you know, one of those things
Just a little
that just
mishap.
happens. Yeah,
Yeah.
yeah. There's still, you know, there's no rhyme or reason. It's not anything that anyone's done in pregnancy or
Yeah.
anything. It's just that there's no.
That's one of the, I
Unfortunately, we
think,
don't
as
know.
a mum, that's one of the first things. As soon as you get told that your child's got something wrong with them, essentially, your first thought is, oh my God, what have I done? Have I missed something? Have I done something wrong? Like, could I have prevented it? That was one of my first questions as well. And it was like, it's not anything to do with pregnancy, the mum, anything. It can run in the genes.
Yeah, I guess that can be possibly reassuring in a way, but it's yeah, that again, that's totally logical. You go, oh, did I eat
Yeah.
something? Did I not do something that I was supposed to do,
Yeah.
or whatever it might be? The natural thing is sort of to look at yourself and go, what have I done? But you
Yeah.
didn't. Like it is honestly just a roll of the dice. I
Yeah.
don't. Yeah, it is just Ollie is one of those 1 in 5,000 like myself. You know,
Yeah.
no family history or anything.
It's
It's
one of
just
the lucky ones that was chosen.
lucky is a term. Yeah,
It's maybe not the right
it's definitely a
one.
term. But yeah, it is. It is, and for anyone listening who maybe has just had a child diagnosed with Hirschsprung's, it is one of those things. It's not your fault. You know,
Yeah.
it is just it's nothing you've done. It's
Yeah.
all research will point to the fact that it is just a random game of chance, I guess.
Yeah. It is. It definitely is.
So with that being said, Ollie being now 8 days old,
Yep.
just diagnosed with Hirschsprung's, thankfully you've been given quite a bit of info
Yep.
on sort of what to look for, what to do. I'm guessing things like enterocolitis was mentioned in there.
Enterocolitis was mentioned yet. We hadn't came across it just yet. But once he had his diagnosis, we were then introduced to rectal washouts, where obviously you have your catheter and your saline and things, and you flush them out essentially that way. For anything that's blocked in his bowel, we can remove it because obviously, essentially, he can't. That's the whole problem. So with that, we did the rectal flush outs. Doctors and surgeons did them first, and then we got shown how to do it so that we could get home. Ollie he's been diagnosed, it's long segment Hirschsprungs that he has. And the surgeon that he was given at the start was more than happy to do it. He knew what Hirschsprungs was and knew everything about it until they investigated Ollie a little bit further and realised he was a little bit more advanced than an average child with Hirschsprungs. So we had to change surgeons to a surgeon that had just come back from Australia. And essentially he was now our surgeon for the whole of Ollie's life up until now. But basically everything at the top half of Ollie, everything had to get spun round because he had long segment Hirschsprung. So everything essentially inside him all got removed and turned upside down essentially when he had his first operation.
And
And it'll make more sense with more up to date information.
would that be the pull through then?
Yes.
Wow.
So when he was diagnosed at 8 days old, we were then told then that essentially he would need bowel pull through surgery. It was set for he would have been 2 months old when that was put in place to do, and then when Ollie went into the hospital to get it done, he went into hospital maybe the week before with suspected enterocolitis.
Oh no, the dreaded
So that,
EC.
yes, that was our first kind of a insight into what enterocolitis was, and it's not pretty.
It really isn't. No,
It's
it's
not, and it's
yeah,
not your average sickness and diarrhea bug, because even now, like, I'll explain to Ollie things and how he can be fine just now, and within half an hour it could change because enterocolitis hits so fast, and it's probably one of the most dangerous infections that you can have if you don't catch it very quickly.
it is most definitely. Yeah, it is definitely. But like you say, it is very fast acting, and
Yeah,
it can be very sudden, and it's again, it's that awareness, and it doesn't have huge amount of symptoms from what I'm
yeah,
aware. But there are certain signs that you can see, and you think,
yeah.
oh, actually, something's not quite right here.
Uh-huh. And
And
it's a little bit annoying as well, because even still now, when you get the blood tests and the stool samples and things like that, it never ever comes back completely positive for enterocolitis. They just automatically treat it as enterocolitis because it has got the symptoms. It could be another bug, but they'll always go and treat it as enterocolitis just to keep it on the safe side of things.
yeah, I think it's always best to err on the side of caution at that
Yeah,
point, especially with Hirschsprung's, and especially with what enterocolitis can do if
yeah,
obviously not treated.
yeah.
But excellent that you kind of caught it quickly, I guess.
It's a very isolating infection, because when Ollie gets taken into the hospital with enterocolitis, because it is obviously an infection, it gets put into source. He's not allowed any visitors, he's not allowed out the room, he's not allowed anything. But he's maybe in his life, he's maybe had about 5 or 6 episodes where it's been suspected enterocolitis that he's been in hospital with. He's had about 5 or 6, but quite a lot of them were before he had his pull through and after he's had his reversal.
Right. See, yeah, I mean that's still quite a lot, 5 or 6.
It is quite a lot. He's now 11 and he's not had it for, I don't know, maybe about 4 years, maybe. He's not had a symptom of enterocolitis or anything. But when he was about 4 months old, he then got the green light to get his pull through surgery.
Good, but I mean
But
it's good to know that hasn't had anything for the last 4 years or so. But has there been anything within that time that you've done differently to try and sort of
so
negate
the
it?
only the only thing differently he has is there's been different medications that he's tried to try and thicken poo. There's been the probiotic yogurts. He's had Botox injections. But when he had his bowel pull through, they told us that it would be pretty straightforward, and we would only be away for a few hours. In the worst case scenario, he would come back with a stoma, but they would really, really try and not make that be the case. So on the day of Ollie's surgery, he went down to theatre. Everything was fine. After the kind of a 4 hour mark, alarm bells started ringing because I was like, why is he not back yet? Then the 6 hour mark went past. I was very, very slowly starting to freak out. And we were in a 4 bed bay in the hospital, and in our hospital, they've got like hospital clowns and things. So there was another baby on this 4 bed bay. I'll always remember it. And they came in and they were blowing bubbles and they had their tambourines and they were singing and dancing. And I was sitting next to an empty bed, slowly losing the will to live. And I was like, please just leave. With all due respect, please just go just now. So then about 8.5 hours had gone and his surgeon walked towards me and I was like, oh no. And basically they had said that it was more advanced, there was a lot more to remove, and so he's had to come back with a stoma bag at the same time. So we were trying to prepare for the stoma bag, but at the same time they did say if it wasn't needed, if they could get away with not, then that would be fine. So that, as much as he's just went for life-saving changing surgery, he's now then came back with something else that we didn't think he was going to have. And if you haven't ever saw a stoma before, it's it's quite scary looking.
Yeah.
It's bizarre. It's not the nicest. It freaked me out a little bit, but it seemed to work, and it seemed he had his stoma bag for maybe about 6 months, and what a difference that made. With there was no infections, there was no, he didn't have any symptoms of enterocolitis, and from that point I was thinking maybe a stoma bag is actually the right thing for him, because up until the point of him being born, to get him the stoma bag, it was in the hospital every month, maybe twice every month for a week at a time with enterocolitis. It was a lot on him. But Ollie being Ollie, it's a standing joke now that if it wasn't for bad luck, we wouldn't have any. He caught a wound infection around his stoma, and on Mother's Day, which was maybe 2 or 3 days later, his stoma prolapsed, and that was something else.
With the prolapse, I've heard this from several people before, but
Yeah.
did they give you the sugar trick?
Yes,
Did it work?
it did. It took a while to go back in, so if nobody has saw a stoma prolapse before, the only way that I could describe it, it's like an octopus tentacle. Like that's the only way that I can describe it to anybody so that they realise like what it looks like. So it came out, so we had to cover him and hold it in, and the surgeons came, and eventually it went back in, which was fine. It was perfect. So then were told that if it happens again, he might need to go back to theatre because they might need to kind of put it back in and stitch it kind of on the sides. So we had left and went home that night. We had the option to stay in Ronald McDonald House, but we stay literally 15 minutes from the hospital. So we were like, we're close enough to get there. And because he was in intensive care, you're not allowed to stay in the hospital anyway. So we had gone home and the hospital had phoned through the night and it had prolapsed again. So we were like, okay, so we took ourselves to the hospital. They managed to put it back in again and it stayed back in, but it was on very close watch for needing to go back to theatre again. But it never came back out again. Everything was fine. And then he then had his reversal, which went swimmingly. Nothing really happened in the run up to that. He got his reversal, everything was fine. The only problem he had when they reversed it, he then had another wound infection. But I think because his whole system, he doesn't have an immune system in there, or anything that he gets attacks his bowel. So I think anytime he gets anything done, any surgeries or anything, he gets some form of infection. But I think it's just a really run down area, which you've got to take the good with the bad. And like, I'll take a wound infection over enterocolitis
Yeah.
rather than, do you know what I mean? I would rather have that. So the only thing that he had was he had a wound infection, and then the vomiting and the diarrhea started a couple of days later.
Mm, not nice.
So I was like, right, okay. Wasn't enterocolitis. He had norovirus that he's caught while being in the hospital. So he's maybe had norovirus 3 times, and every time it puts him into the hospital because obviously, as you know, everything just goes for your bowel. It goes for your bowel, and because Ollie only has a fifth of his bowel left, and because of that, it doesn't really hold absorption of water or anything, so he dehydrates really quickly. So obviously, sickness and diarrhea, you do dehydrate anyway, but with a child with Hirschsprungs and only a fifth of his bowel left, it's on another level. So it always puts him into the hospital, put on fluids to bring his hydration and things back up, and then start again. So every time he's been in, he's been brought home with antibiotics. He's either had metronidazole or comoxiclav, are always the two that he gets given. But again, to me, when all this kind of started in the norovirus, I know that obviously isn't a bowel related necessarily infection, but the infections and the enterocolitis and things seem to come back when he had his stoma reversal. So from then, I had in my head and I had talks with these surgeons, and I was like, I think a stoma bag is the way forward for Ollie. It seemed to be when he had that stoma bag, and that whole time before he got his reversal, he was never in the hospital. He never had an infection. He was doing well in himself. Everything seemed to have changed. And then when he got the reversal, it was as if we went back the way, as if it gave you that little glimpse of hope that that's what life could be like. But then it took away and go, no, that's not for you. Which
Yeah.
obviously wasn't the greatest. And I get sometimes with Hirschsprungs and the treatments and things, it's trial and error, which is annoying in itself because you obviously want what I thought was best for Ollie was a stoma bag, but it's obviously not always the answer. Surgeries aren't always the answer because after they've had surgery so many times, they kind of I don't want to put them through that again or put them through the trauma or anything. So I get that, and I get there's always another option. a less invasive option or anything like that. So once he'd had his stoma reversal, we then had to do rectal washouts with the anal dilations with the rod. It was a 10 millimetre metal rod to open up his bum and then do the washouts like we did when he was a brand new baby. And we did them, but we had to do it twice a day, every day, which is quite a lot. And it's a lot of pressure. I think, obviously, as a parent, you do it. It's your child, you do it. If it's going to help them, you do it. But mentally, it's a lot. It's a lot to try and master, get to terms with it, and realise that you then have to do this on your child, but you're doing it on your child to give them the best possible outcome and the best possible life. But I think the whole process with Hirschsprungs is a very, very mentally challenging one, like ridiculously mentally challenging.
Yeah,
A
and I
lot.
think that it is on everyone,
Yeah,
parents and people with Hirschsprungs, and I
yeah.
think that's something that I have talked to parents about a little bit, but probably not as often as I would like.
Hmm.
That there's a lot of invasive procedures when
Yeah,
it comes to Hirschsprungs, and I think that has a huge toll mentally, especially if you are the person who is performing the procedures as well.
yeah,
And I think this is always going to be the thing of, am I doing this 100% correctly? Am I,
yeah,
all of that stuff. And I think same with people with Hirschsprungs, having a lot of invasive procedures,
yeah,
especially within the stomach area as well, um, is very mentally draining.
yeah,
And especially with the lot of research that I've read in terms of the gut health and mental health being hugely linked, I think it's not a surprise that Hirschsprung's is quite a mentally draining, or can be quite a mentally draining condition.
yeah. No, definitely. I do think, and I think sometimes as well, I always think to myself, God, would I like somebody to be doing that to me all the time? Do you know? And obviously, he was a lot younger then, but it seems to be harder the older he got. The Ollie's thing was he loved going to the hospital. As soon as he took not well, loved it. The only child I know loved going to the hospital, loved seeing everybody in the hospital, was on first name terms with all the doctors and nurses. We would go up every single morning. We would be there from like 7 o'clock in the morning for the nurse changeover to see what happens through the night, and we would be there the whole night until it got to a point where it was on a ward where we could stay, and we would go up, and Ollie would be sitting in his pram out at the nurse's station, just making pals, making friends with everybody. And that was his thing, as if in a very strange and roundabout way, as if that was his safe space, being there, because he knew all the nurses, he knew who was looking after him. And he got to a stage where in the hospital, if he had a cannula or anything in, which they struggled massively with him eventually, if he had them in his feet, they would keep his socks on for him to go to bed. And it seems to be that even now, he's 11, he won't go to bed unless he's got his socks on. It's like little things like that. And I'm like, they obviously go in and they stay in there because that's his normal.
Yeah.
That's his normal, and he thinks it's not any different. But
I,
the older he got, to take him to hospital, he would know he wasn't well. But then it would be do I need to get a jag? Do I need to get my bloods done? Do they need to touch my bum? Do they need to put anything? And it was all the kind of questions, and all the questions sometimes I didn't have the answer to. But then that made me a bad person because I couldn't tell him. Because me then saying, I don't know, didn't help him in his head come to terms with what was going to happen when he got in there at the same time.
that doesn't make you a bad person. That doesn't make
It
you a
was
bad
just,
person at
and
all.
like,
But
I
I
feel
know,
like the whole time I always somehow had an answer for him. And then when he got older and he could ask questions, and I was like, I'm not really the person that to give you the answer to that question. But even now, like when he's in hospital, he then the older he's got, it's as if he becomes a little bit more reserved and shy and doesn't want to ask. If a surgeon's speaking to him, he won't ask. He'll look at me as if you ask, or he'll say it once they've walked away, and I'm like, you are a bigger person now. You need to be the person to ask the questions, because I don't know what it feels like inside. I don't know. Like, it needs to come from him. He's the best person to tell anybody.
Yeah, yeah. It's a tricky one, isn't it? It's a
Yeah,
really tricky one because yes, it absolutely. He's the one who knows how he's feeling and
yeah,
would be the best place to ask those questions. But also, I guess being the age he is now, it can sometimes be a bit tricky to talk about certain things with Hirschsprungs. So it's it's
yeah.
it's that really tricky balancing act, I guess.
I think with obviously certain areas of Hirschsprung's, it's a little bit private. It can be embarrassing, and I get that. I do get that. And I'm like, you need to obviously, the older he's got, and he's had 4 rounds of the Botox injections, which are there essentially to retrain the brain to the bubble on how to work and how to let go. Because Ollie's thing, the older he was getting, not even the older he was getting, he seemed to have more accidents at night time through the night. But obviously, essentially, everything's more relaxed at night time. But on the same hand, Ollie wasn't letting fully go during the day. So there was too much at night time. So the Botox injections seemed to be the next option for him that weren't necessarily invasive surgery related. Yeah, you got taken to theatre and put to sleep, but you were only there for about 40 minutes. And it was pretty straightforward and everything was fine. So he had them 4 times he's had them now. The first 3 times didn't see any change, but they do say it can work, it might not work, but you need to try it. So for the first 3 times there was no significant change. Everything kind of stayed the same. On the fourth, everything started to change after the first week for maybe about 4 weeks. And then it went right back to normal again.
Right.
Where he was managing, he could tell you that he needed to go to the toilet. Whereas, obviously, with a child with Hirschsprung's, depending on the form that you have, you don't know that you've went to the toilet, which was Ollie's thing that he struggled with massively, and we were trying to get it under control for going to school. So when he started school, I had several meetings with the school to obviously explain the situation, and that if Ollie needs to go to the toilet, he needs to go there and then. He can't wait 3 minutes until the teacher's done talking to somebody, because in that 3 minutes, everything can change. And I had a bit of trouble with the school. I had taken everything in from the care package and things that they had from nursery, all hospital letters and everything, and took it to the school. And essentially, the head teacher at the school just said that I hadn't toilet trained them and that I was lazy, and I had taught him how to go to the toilet for a pee, but hadn't taught him how to go to the toilet to go for a poo. And that's what the problem was. So when he was at school, I was fighting a losing battle. Didn't think that it would ever be a thing. I didn't think I would then be questioned or made to feel that size with my child's disability. But I was lazy and hadn't toilet trained him.
Horrific. I mean, I guess the question would be, did they even know what Hirschsprung's was?
So that was me. I took my little booklet,
Yeah.
took it all in, and I asked her very politely if she could have a read of it and then come back to me if she still felt the same. So with that being said, and obviously them not really thinking that there was anything wrong with Ollie, there was several, very, very several occasions Ollie would come home and he'd had an accident, a significant accident. He was soiled. He then, I picked him up one day from school and he had soiled, and I could smell it when I got him. So I was like, how could nobody else? Surely somebody else. And then my thinking was, he was only in primary one, primary two, maybe. And I was like, kids can be horrible. And with Hirschsprungs especially, it's always been my fear on how horrible kids can be. And essentially, it is probably the first pick to be bullied if it's not under wraps and you don't take care of it and have everything in place. So I had got Ollie from school one day and he was soiled. His bum was red raw, and it turned into a bacterial infection that he had because he had sat, and it was every single day it was happening, and he's been sitting for 6 hours and couldn't get it under control. So I had to fight until he was maybe in primary three, primary four, and then eventually he was given a one-to-one teacher for going to the toilets, and she did her research on Hirschsprungs and stuff. And I know not everybody knows about Hirschsprungs. There's not going to be a teacher support out there that knows essentially what it is. But ideally, I wasn't asking her to do anything related to Hirschsprungs. It was just a case of, please make sure he goes to the toilet. If he's soiled, there's a bag of clothes to change him. He's got wipes, he's got his creams, he's got everything there to try and prevent that from happening again. That happened for maybe 6 months, and then that teacher left and they never told me. Ollie came home one day and told me we had a wee jotter that stayed in his bag, and she would fill it in and write if she had to change him, if she had to put his creams on, what time, and all that, so that I could keep track of it at school, essentially more so for the surgeon at hospital who asks how he gets on at school. And then I would do the same. So if he had an extra sore stomach or his bum had more broke out, I would write it in the jotter, and then that would be fine. And then that was took away without anybody telling me. So then we were right back to square one again. Even now, it's probably fighting a losing battle. So then the teachers were like, "What if he has a toilet card?" And I was like, "Well, that he should have had that from the beginning. It took for him to get to primary five, primary six, for you to realise, oh, hang on a second here, there is actually something." The amount of school that he missed, he still misses school, to be fair. Maybe not so much a lot now, but the amount of school that he missed and they still couldn't see what the problem was or what was actually going on. I think sometimes people are quite naive with it and they just think it's just a sore stomach. And all he could get up and they'd be like, my stomach's really sore. You can hear it grumbling, you can hear it gurgling, and you think it's happening. Which is what happened last week when I was supposed to come on here. He got up that morning and you could hear him grumbling, and I was like, oh, here we go. And he was in and out the toilet all day. So I'm like, it just literally can happen so quickly. He was fine the night before, got up that morning, and it was there. Pain relief, Calpol, ibuprofen, everything seems to be where go to. There's mornings that he'll get up and he needs to take it before he goes to school. There's mornings he'll get up and he gets himself upset because he hates having Hirschsprungs. I've had that on several occasions. I've had, why was it me that had to have Hirschsprungs? Why could somebody else not have it? And sometimes when he's in that frame of mind, if I then try and help, but you don't know what it feels like to have Hirschsprungs. And I'm like, he's right, I don't. I can just see him from the outside and know everything that he's had done and everything we can do to help it, but I physically don't know what it feels like, and I never ever will.
No, I get that. I've been there. I've been there with, why was I the one in 5,000?
Yeah,
Why was Ollie the one in 5,000?
yeah,
And unfortunately, as we sit here, both of us don't have the answers.
yeah,
We can't say, well, actually, it was because of there isn't an answer, and that I
yeah.
guess
There isn't a definitive,
so difficult.
this is the reason why you've got it, or there's nothing. And obviously it's that I find more emotionally draining and mentally draining now that he's at that stage in life where he's like, well, why was it me?
Yeah,
Why was it not? And also, he's not been diagnosed as of yet, but there's an undiagnosis of ADHD to Ollie, which a surgeon actually picked up on a few years ago, and then his optician had kind of picked up on. We have always thought it, but a surgeon did say obviously it's trauma related, and the amount of trauma that he's been through, he did say there is a number of folk that do have Hirschsprung's and ADHD or autism, or because it is trauma related. And when you think back to them being obviously newborns up until now, that's a lot of trauma for one person to deal with.
and
It's a lot.
it's it makes absolute sense, and
Yeah,
also it's a lot of trauma that we can't get out either because we can't
yeah,
most of the time when everything's happening, we can't communicate, never mind talk.
yeah,
So there's that as well, I guess.
yeah. And we seem to notice that that didn't really help the older he got with hospitals and the procedures and things to get done, because he then gets into his own head and it kicks in and he's like, well, I don't want to do that. Like, it's not, he knows it's going to make him better, but in that frame of mind, he's like, no,
Yeah.
it's too much. There's too much going on. And I get that with him. So, more recently, and maybe I was, say, August of last year, we were back in talks again with his surgeon, and it was the smearing through the night seemed to be the problem essentially, and it was more what works for us as a family now more than it just being about Ollie. Ollie's obviously older, but it's what's going to help his mum, his dad, his sister in this whole process, because there's times where you've had to get up with Ollie at 2, 3, 4, 5 in the morning. You've had to strip his bed, you've had to run him a bath, everybody's up, the whole house is in turmoil, he's having a broken sleep, everybody's having a broken sleep, and it's not helping any situation. Then he's missing school because he's up through the night, and then I can't get him up in the morning because he's been awake for 4 hours through the night. And I always, even still now until then, I was always saying a stoma bag. A stoma bag is definitely, it worked then. I don't understand why it wouldn't work now. He's older. So we were then spoke to, and a surgeon obviously didn't want another invasive surgery, which is fine. I get that. I get that if there's not us, if you don't need surgery, don't do it. That's fine. But they then wanted us to try and do rectal flush outs again at the age of 10. And obviously, with the undiagnosis of ADHD, I was like, mentally, it's not going to work for him. And then it would be, he would have to get it done. He could either get it done every morning or every night. They gave us the stuff home to try, and I don't even think, I can't even remember the name of it. And we had the little, I don't even have one that I could show you. I can't even remember the name of it. And that essentially would go in to his bum and then you would fill it with saline that way. But we stood in the toilet, got him into the position he needed to be in, and it wasn't even in properly, and he was screaming the place down. And right away, within that 30 seconds, I was like, this is not going to work. Before, when the surgeon even gave it as an option, right away in my head, I'm like, no. It, I know Ollie, and I'm not being funny, but any child at the age of 10 is not going to want to let you do that, let's be honest. That's too invasive. Yeah, he did it when I was a baby, but he was a newborn baby, couldn't walk, couldn't talk, didn't really know what was happening. Whereas now I'm like, mentally for me, I don't think I could put him through that. And then he obviously would need it done every single day. And with all his frame of mind, he could have it done today, but tomorrow he could be like, I'm not doing that. I'm not getting that done every single day. And then it would be fighting a losing battle. And then we would be right back to square one again. So then there was talks of getting a I'm reading this off my bit of paper because I don't know how to say it. A laparoscopic appendicostomy.
Sounds good to me.
Maybe isn't right. If there's a surgeon out there, I do apologise. But it's shortened down as an ACE.
Yeah.
So we'll call it an ACE. So in November of 2025, that's when he got that given, and it's essentially, it is a still a stoma, but it gets connected onto your appendix. But because of all his previous reversal and pull through surgery, everything had turned upside down. So with that, your appendix is essentially on your right hand side. When the surgeons went to do Ollie's was on the left hand side. Everything had moved right over. So I've kept this letter here because this is essentially everything that he got done just in November there. So this is his most recent and up to date hospital letter. He so everything was over just underneath the spleen on his left hand side. So his ace should essentially have been on the right hand side, but everything was stuck to his left and there was no way of moving anything. So he now has his ace fitted on the left hand side, which is connected into his appendix, but it looks like a pig's tail on the end of it, and
Yeah.
it wraps round there. So he's had that since November, and wow, what a difference. We just do his flush outs through that with the bag, hook them all on together, clean it all, and he's there. And it takes about 45 minutes and he's done. And he's now got to the stage where he does it himself. He's comfortable enough to do it himself. And he even said after the first few weeks, he was kind of like, obviously it's a foreign object on you again, and it's quite a big thing, and he wouldn't look at it or anything like that to start with, but now he's more than comfortable. Won't show anybody it, doesn't tell anybody, not a lot of people. If you're family and very, very close friends, you would know Ollie has Hirschsprungs because he would tell you. But when he was younger, after he had his reversal, he had a big scar on his stomach and he would go out and play with his friends and they would notice the scar and he would tell them that he'd been bit by a shark. He won't tell them that he's got actually something wrong with him. So now we've got the ACE, and that's been November, December, January, February, March. 6 months he's had it, and what a difference that's made
Yeah.
to
Most
get him to
definitely.
where he is now.
With the ACE,
Yep,
because that's one thing I can talk about that I do know about, that I had done 25 years ago.
yep,
It might be a little bit different then than it is now.
yep,
But in terms of obviously the ace itself and where the site is there
Yeah.
anything put over the ace?
So you don't have to. You can go without, but because it's connected to your appendix, it's quite a wet area with mucus and things because of where it is. It'll always be wet. So Ollie just puts a dressing over the top of his, and we just change the dressing every day along with when he gets his flush. He's had trial and error with dressings and things. He's took an allergic reaction to the initial dressing. And then I don't think his skin just now will ever really be completely clear because you're covering that piece of skin with a dressing every single day. It's going to dry up, it's going to be red and inflamed and things. We've got several creams and things to put over the top of it. If he's in the house, he's comfortable enough to go without a dressing, but if he's out and about or anything, no, he needs to have a dressing on. But I had found a page when he had a stoma. I used to have stoma coverings and it would have like Batman, Spider Man, anything like that on it. But I've found a page, I don't know where they're based, but it was on Facebook and they do little coverings and things for it. So they're not that expensive. So I think I'm going to get him a couple of them just so that he can keep the dressing off every so often because his skin is obviously quite bad. But it's what's keeping him going and it's definitely done the trick.
No, that's really, really good to hear. Really, really
And
good to hear.
that's,
I think going back to my one, it just I think I had what's called a tegaderm, like a clear um, plaster essentially
yeah,
over the top. So I think it's kind of similar thing, but it's sort of
yeah,
moved on a little bit, which is really, really good to hear.
yeah.
Um, but yeah, I think but it's so good to hear the ace is doing what it's supposed to do, and that
Yeah,
it's really, really improved his quality of life, which is fantastic.
it's like a
Um,
big never ending circle. You need to try everything and go around every single option before you find the one that's right for you. And now we're just thinking, why could we not have found the ace sooner?
yeah,
But he's got it now. He's got it now,
exactly.
and that's just the way it is now.
And then speaking of now, I know you talked about the ace. You've talked about how well that Ollie's getting on.
Yep.
In terms of Ollie himself, how's he now, and what do you sort of hope for the future?
He is absolutely fine. He still obviously has the odd flare up, so to speak. That will never ever go away, regardless of whether he's got an ace or not. Within the year, they'll do an ACE update and he'll go in and they'll have a check of it because he has the child one just now. If when he goes back into hospital within the year, they think that he still needs, they can then change the ACE to then, I'm sure it's a button and it's just a bigger one for him because obviously he's grown with it. But that would obviously be up to the surgeons and whether or not they think if it's been beneficial for this length of time, then they might just be like, right, that needs to be a thing that he does have for another while and then review it all again and then see what's what when he's a wee bit older. But it's not stopped him doing anything. He's a footballer. He doesn't, he's wild. He's absolutely wild. You would never ever think, like, even when we're talking to some people and they're like, you would never think he had anything wrong with him. But it's
Yeah,
because it's what's on the inside.
yeah, yeah, exactly. But that's so good to hear that it hasn't stopped him from playing football or running
No,
around
it's
or
not.
anything like that. That is so good to hear, especially people think, oh well, I've got stoma and I might not be able to do this, that, the other. But really, really, really good to hear.
before before he got his ace, that was the first thing that he asked was would he still be able to play football? And his surgeon, luckily the surgeon that we had was very sporty, was very sports orientated, and he was like, I would never take it away. He was like, so I know that if you have this, it's not going to stop you. And it's not. It really, really hasn't. And it's amazing to see how far he's come from being a really, really poorly baby touch and go to now he's 11. Yeah, he's got an ace and it's there, but it's doing its job.
Brilliant. No, that's
It's
so
doing
good to
its
hear.
job.
But thank you so, so much for coming on. This has been
No,
an
thank you for
excellent
having me.
episode. And I wish, obviously, Ollie, yourself, and the rest of the family all the very best for the future.
Thank you so much. Thank you for having me.